Hi, my name is Muhammad Azhar bin Azumat. So, hi, hi. How should I address you? Okay, madam. So, hi, madam. Thank you for joining the appointment today for this session. So, I hope everything is fine. How are you today? Oh, good. Okay. So today I will be your doctor. So you can call me Azhar or doctor. You can call me anything that will make you comfortable. Well, after doing some history taking, I just want to confirm again. Is it okay with you? Okay. So you still take metformin 500 milligrams once per day, isn't it? Okay. So you never have any periodontal treatment before this. I mean, have you have heard of periodontium or periodontal before this? Okay, that's fine. So, did you did any tooth extraction before this? I take note you did some tooth extraction before this. How was it? Does it hurt? Is it healed yet? Okay, nice. Oh, you are a businesswoman. I see. It must be stressful for you, isn't it? I will take note for that. So, let's get to the point. So, well, what are we doing? What are we doing? What are we doing here today? So, in this appointment today, I would like to achieve some goals with you. First, as your doctor, as your doctor, I want to prevent any future oral or mouth diseases of madams, and also I want to improve dental health and systemic health as general of you, and because I want to because the mouth is connected to the whole body. So if you want to have a good systemic health, we need to improve your dental health because it's connected. And then the last one is I want to promote proper dental hygiene skill. So yeah, is that okay with you? Okay, so yeah, next we go to the next part. So in this session, we have six parts that we need to do. Six parts of this dental hygiene education. So I will explain to you later, and we will go one by one. So the first one is what is periodontium? I want you to wonder that. And then what is periodontal disease progression, and why we don't want dental plaque, and periodontal charting analysis, and oral hygiene demonstration, and periodontal treatment. So for what is periodontium, I'm just going to explain to you what is periodontium, and then I'm going to explain to you what is periodontal disease progression, and then I'm going to explain to you what is dental plaque and why we don't want dental plaque to accumulate in our mouth, and then we want to do some periodontal charting analysis with you because I have the periodontal charting that I get from the last doctor. So I want to do some analysis with you, and then I want to do some oral hygiene demonstration. We make some oral hygiene demonstration together, and then the last one I want to do some periodontal treatment. I want to plan some periodontal treatment with you. Is that okay with you? Okay. Okay, first, to achieve the first goal, which is to prevent future oral health disease, you need to understand what is the component of the mouth or the oral. So, this is the general anatomy of the mouth, of the periodontium, and I want you to focus on the structure periodontium, which is stated there, which is four of them. So, what is periodontium that I've been talking about before this? Well, periodontium is, if you ask in the book, well, periodontium is basically a specialized tissue that support, protect, and hold the teeth. The component of the periodontium is basically the gingiva, cementum, periodontal ligament, and alveolar bone. So, why we need this periodontium? So, we need this periodontium is basically to protect the teeth and hold the tooth in place. So, if the periodontium loose or lessen, the teeth will become mobile and finally extracted from its place. So, your tooth will lose and you cannot eat your food. So, yeah. So basically, periodontium is the structures of the tissue that holds the teeth in place. Yeah, to avoid it from moving, because moving teeth is not good, and we want to preserve the teeth. so that you don't have to do some implants or dentures. And yeah, we don't want to lose our teeth, so we need to preserve the periodontium to preserve the teeth. So that's what happening. So next, let's learn about the progression of these periodontal disease, that we lose and lessen the periodontium, which is the four of these periodontium parts. This is, as you can see, this is the progression of periodontal. This is the big deal that we are talking right now. So, as you can see here, the progression of the periodontal disease, you can see that coming from the healthy gums, and then the teeth is fine. The periodontium is fine. It doesn't have any diseases. But the main problem is when the plaque is accumulated in between the teeth. It will sit at the periodontal pocket, the pocket that exists in our gums. It will sit at the tooth or anything. So what happens is that this plaque has like sucrose. It's like a food, or a place basically. So because the plaque is basically the food that we eat that remains on these spaces that exist in our tooth. So then the bacteria will use this sucrose, will eat. It's become their food. So they will eat this food, and they will use this to food, and they will multiply, and and in that process they will destroy this periodontium, these four components that I just mentioned before: the gingiva, periodontal ligament, the cementum, and also the bone. So this bacteria will produce some kind of acids that will destroy the periodontium. And what happens? And also there's calculus. Calculus is just basically hardened plaque. I don't want to complicate that one, and that's fine. And then what happens? And then what happens when there's too many bacteria happens there? Inflammation will happen because our body doesn't like too much bacteria, and if there is some destruction on the periodontium, the body will uh, induce this uh, induce this a body response, which is inflammation. They will cause bleeding, and there's so many things happen because the bacteria will uh, the bacteria will destroy this body, it destroy this periodontium, and the body doesn't like it. So the body response is to do inflammation, to avoid, to delete this bacteria. And then due to destruction of the periodontal pocket, I'm sorry, destruction of the periodontal pocket will deepen. The spaces between the tooth will deepen and will destroy, and then there's more plaque happening, and there's more bacteria will reside, and then the bacteria will destroy the bone, and then the bone level will reduce, and then the tools become more mobile, and then the tool become extracted. So that's what happening. And we have some stages, which is the healthy gums. Nothing happens there, but it starts to become bad when the plaque started accumulated, and we don't do some plaque control, which is through plaque. We don't do some plaque control because it will slowly progress from gingivitis, mild periodontitis, moderate periodontitis, and severe periodontitis. And we want to avoid that. So next we are going to the next part. So next, I'm going to explain about dental plaque. So what is dental plaque? Dental plaque is just like a fancy name for food or remnants that happens to be stuck in the mouth. So like if you can see from this picture, is that the yellowish one. I mean, tooth is supposed to be at the top part of the tooth is supposed to be white, and then you can see the yellowish one. It's like food debris or remnants that we eat. Maybe we eat some sugary food or rice or many food. Usually those food will stuck, especially like rice, like sugary sugary food, or anything that happens to be glucose or has sucrose. You can see that the yellowish one that happens to be stuck around the tooth, and it stays there. And this is not a good thing because if the food stays there, the bacteria that happens to be exist there will multiply, and they will grow into a colony, and then they will destroy the tooth. So that's why we don't want to have dental plaque. And maybe we can avoid to have dental plaque, but we can control the amount or control the dental plaque with brushing teeth or flossing and incidental brush. So we want to control this dental plaque through the brushing technique, because if we let the dental plaque to stay there for a very very long time, then our tooth uh, will will have diseases, and it will corrode, and there are so many things. Maybe you don't see it, but later, in the next 3 years, if you don't brush your teeth, and then bam, you lose your teeth, and then maybe you have pain, and maybe your tooth happens to have caries and all the kind of stuff. So we want to avoid those. So this is one of the other purpose that I'm going to deliver to you. So next, I'm going to explain about the periodontal chatting. And what is periodontal chatting? And I will explain later. So we already finished three parts of this dental hygiene education, which is we already finished the what is periodontium. We already achieved that, and we already know what is periodontal disease progression, and why we don't want dental plaque, because dental plaque is the bad guy here. So next, I'm going to do some periodontal chatting analysis of your periodontal chatting, and I will explain later what is periodontal chatting. Next, let's look at the periodontal charting of your meadow. So what is periodontal charting? Periodontal charting is basically the measurement that we dentists use to assess the health of the periodontium. So let's look at one by one. So for mobility is basically the measurement that we use to assess each tooth movement of the tooth. Nah. So high mobility means that the tooth is likely to have low periodontium components that's supposed to hold the tooth. So high mobility of the tooth is not good. All right. High mobility of the tooth is not good. Is due to the low periodontium component that supports the tooth. And then we can see the Furcation is basically to see whether there is any root of or tooth that is exposed within examinations of your mouth, of your tooth. And in Madam's case, there is one tooth which is 1/6. Over there, you can see this 1/6 that has furcation exposed, which means that the alveolar bone, aka one of the periodontium component, has lost. And you can see that the tooth has graded mobility of 1. So the reason the mobility of is graded 1 is because the bone has lost in that area. Some percentage of the bone has lost in that area, which means that less bone, less support to the tooth. So you understand what I'm trying to say? And then next, bleeding on probing. So bleeding on probing it simply means that the one that which is, the tooth has inflammation, the one that I just explained, and we don't want inflammation. So if there's blood on probing on the tooth, which means that it has inflammation, and we don't want that, which means that the periodontium is not healthy. So what is inflammation? Inflammation is basically the gingival response to high plaque, because the body is trying to kill the bacteria, just like I said before. And yeah, that's it. And then for plaque is you can see here is that the blue color is the plaque that stays in your gum. It stays in your gum. So with this with this blue, we can see that where is the plaque is most resided in. We can see where is the most accumulated plaque, and we can try to reduce the plaque. And with that, but yes, I will get back to that later for the plaque one, because we're gonna need that. But it's okay, we'll get back later. And then gingival margin. Okay, so gingival margin is basically we want to see the recession of the gingiva. We want to see how much is the gingiva gingiva is surrounded on the tooth. So less gingiva, less good. Less periodontium, less support to the tooth. Simple as that. And then the last one is the probing depth. So probing depth is like the depth of the periodontal pocket. And just like I mentioned before, periodontal pocket is the home, is the place where the plug can reside, it can stays and retain. So like, which means that probing depth means the periodontal pocket is big and it's not good because we don't want the plug to retain there, isn't it? Yeah, that's what happening. And yeah, I think if you have any question, you can ask me. But this is like the most general graphic that I want to touch. And for the other part, I don't want to touch because it's not necessary for the goal for today. So next, I want to focus on the OPG. So what is OPG? OPG is a short form for orthopantogram. So OPG is like X-ray that provides a broad view of the jaw, the teeth, and the surrounding structures of the of the mouth of the jaw. So there are many things that you can see with this OPG, but I want you to focus on one thing, which is the bone that surrounds the teeth. So you can see that there's like a line there at the healthy gingiva. Focus on the healthy gingiva first. There's like a line there, like a curve in between the tooth, isn't it? The same goes at the lower tooth. There's a nice curve there. So if you don't see it properly, you can see at the here. There's like a line there. I already lined it there. It's just nice. Healthy in general, that's good because it supports the tooth. It supports the tooth. But if you look at the right side, at this part of yours, of your OPG, madam, you can see that there's like a little bit of loss there. It's like it doesn't have a nice curve, especially at the lower right. I mean, in your perspective, it's a left and lower line. There's like a lost line there. The same goes at the right lower tooth there. You can see there's a significant loss, a loss of bone there. And if you don't see clear, you can see at the line that I drew, so it make it easier. So based on this, what I'm trying to say is that there are some bone loss without you realizing. And if we let this problem just let it be, then we cannot then the bone will lose and it will cause the tooth to mobile and you will have to uh, you will have to extract your teeth and it's not good. We don't want that. We want to fix what we want to fix and preserve the bone because these bones cannot be repaired being made up again. If it's lost, then it's lost. So the only way that we can do is right now is to preserve the bone that we have right now. So we already finished many parts of this dental hygiene education. So we are getting there. We are just a little bit of your time. Yeah. So we already finished what is periodontium, what is periodontal disease progression, why we don't want dental plaque, and we already finished this now. Periodontal chatting analysis, and I touched a little bit on the OPG. Okay, next I'm going to do some. We are going to do some demonstration on oral hygiene with the models that I have, and I would like to suggest some oral hygiene kit to you for you to use to control the plaque, to control the plaque in our mouth. So we already finished many parts of this dental hygiene education. So we are getting there. We are just a little bit of your time. Yeah. So we already finished what is periodontium, what is periodontal disease progression, why we don't want dental plaque, and we already finished this now. Periodontal chatting analysis, and I touched a little bit on the OPG. Okay, next I'm going to do some. We are going to do some demonstration on oral hygiene with the models that I have, and I would like to suggest some oral hygiene kit to you for you to use to control the plaque, to control the plaque in our mouth. Well, there are many types of dental hygiene kit that out there at the market, but these are the five dental hygiene kit I will suggest you to use, and it's not that expensive. And I don't want to introduce you to many dental hygiene kit because I know that you are very busy with your life, busy with your business. So I only propose these five. So we go one by one, and then I will teach you the proper way to use them. Okay, let's start with the first two of the dental hygiene kit, which I think you actually already have, which is the toothbrush and fluoridated toothpaste. So, before we do some demonstration together, can you take your, because we're in on online call right now, can you take your toothbrush and probably show me how you brush your teeth? Is that okay? Okay, thank you. So, okay, good. Okay, okay, that is good. But I would suggest you to brush your teeth with these two methods that I would like to suggest. I mean, the way I see you brush your teeth is more likely to the best brushing technique. But yeah, it's okay. I'm just going to explain it. So, the first best brushing technique, which I think you probably do, but you didn't do it properly, is that you need to take your tooth and you need to take your toothbrush and put it like 45 degrees and just brush it just like you usually do. But the key here is to do 45 degrees on the tooth and do it at the front and at the back. Same, 45 degrees. So that the brush of the toothbrush can reach the deep pockets and can clean the plaque in the deep pocket. I mean, that's the aim right now. And then next, this method of brushing teeth is good because it's managed to manage the deep pockets or the accumulation of the plaque near along the gum line. And also, I want you to prioritize the brushing teeth. Maybe increase the time on brushing it at this place. Is I want you to prioritize at the buccal and palatal part of the upper teeth, and the lingual part of the lower teeth, which here and here. And yeah, that's it. Okay, so next, the next brushing technique is called still brushing technique. So this technique is to clean specifically at the. I want you to use this clean technique is to clean the upper right first molar, upper right first molar, because there's a friction happen there. So I want you to clean that. I want you to brush it the way which I'm going to show you later on. I just right now. I'm going to show you right now, which is uh, yeah. So how do you use still brushing technique? Is that you take the toothbrush and then I'm sorry, take the toothbrush and then you brush it upwards. Brush it upwards. Yes. I mean, you can do it to the other tooth, but I want you to focus on this teeth at the upper right first molar. Is why there's some clear friction involvement there, and that space, if you don't clean it, the plug can easily stays there, the plug can easily resides there, so the possibility of periodontitis to become severe is high. So we want to clean that properly. So yeah, that's for the first two of the dental hygiene kit. Next dental hygiene kit is that a tongue scraper. This one is the tongue scraper. So this tongue scraper you can buy at the Watson or Guardian, and it's probably cost like 15 ringgit or something. So this tongue scraper is to help to clean the tongue. Without us knowing, the tongue is actually quite dirty, and we never brush it properly. And I personally don't like to brush my tongue using my toothbrush. Instead, I use this one, tongue scraper. So I just take this tongue scraper eh, and then I just brush it like that, and I just pull it like that. This is important because cleaning the tongue can prevent you from any bad breath or any tongue disease. Next one is the fourth dental hygiene kit is this one, floss. I mean, there are many types of floss, but I would recommend you to use this floss, because you said that you are very busy. You are have business, and you are. I'm pretty much you don't have very much time to do this cleaning. So I'll suggest you to use this, and you can buy this like for 5 ringgits for 3 boxes at the Guardian or Watson. So you take this, and then you just floss it your mouth. So you take your floss, and then you take this floss, and then you just clean it clean it like this and push it downwards, and then you after you push it downwards and it goes inside, I want you to uh, I want you to pull it to the right and to the left, so that you can clean the pocket properly. You can clean all the spaces properly, and you can delete all the plug or any food that gets stuck in between the spaces or in the interproximal spaces. And that's for the knee, and that's for the floss. And also, this is easy. You can easily put this in your bag, just like I usually personally do. Just put this in your bag, and whenever you feel like you're free and you're just feeling bored, just take this, and you just can go to the toilet and you just floss. I mean, it's good for your dental health, and you don't feel boring. You can do something other than doing nothing, isn't it? So it's a good suggestion. For the last one is, I would suggest you to buy interdental brush. So this is the shape of the interdental brush. You can buy the same place as Watson or Guardian. You can just buy there. And then what do you do with interdental brush? Well, interdental, in between dental, in between teeth brush. So basically, it's a toothbrush for the in between teeth or interproximal space. So what do you do with this is that I want you to use this and brush at the 1/6 that has the friction exposed, because I'm afraid that the toothbrush doesn't and the floss doesn't clean the friction properly. So yeah, just take the place that has the friction exposed here on 1/6, and then you just clean it. You just push it inside there, and then just clean, just like brushing your teeth. It's like brush that area. And if there is any spaces that I missed, I need you to brush using the interdental brush also. But the main point is on the 1/6, that the one that has the friction exposed, so that we can clean the space properly. So yeah, that's the last one. Okay, so we have finally managed to do many parts of the dental hygiene education. So this is a little bit the last one, which is periodontal treatment. But before that, I just want to refresh back what we already learned, which is we learned about what is periodontium. We learned about what is periodontal disease progression, and we learn why we don't want dental plaque, and we learn about your periodontal charting and about Madam's periodontal charting analysis. And the last one, we learn how to do oral hygiene demonstration together. And for the last one, I'm going to discuss to you about my periodontal treatment plan for the future. So this is the proposed periodontal treatment plan. So for the first appointment, which is 1 to 2 weeks, is that I want to do some scaling and root development on you. So basically, I want to clean any calculus that you have to gum line, because calculus is not good. It's basically a hardened plug, and it's important to clean it, because if we left it untreated, it will irritate the gums and cause periodontal health to worsen. And I want to do some plug score to see if your plug score progressed than before. And then if we manage to finish this by this appointment, I want to do straight to the IC dust charting. And if we don't, I just going to do it, set another appointment for the IC dust charting. And then I also want to do some plug score we want to see the improvement of the plug score. If we improve nicely, then it will be good. And then for the last appointment, which is like 2 months, 2 months from now, which is not urgent, I want to meet up again, and I want to do some. I want to do some maintenance, which is I want to do some. I want to check for plug score again. So I'm going to compare this three plug score, and if it doesn't improved, then I might have to do some. I might have to propose another appointment like 3 months from now or 4 months from now. If the plug score is improved and very well nice, and I don't have any concerns about it, then I will set the next appointment in another 6 months or 7 months. But if it doesn't, I might have to set a closed interval of time of the appointment. So yeah. So we finally managed to finish all the parts of the dental hygiene education. So let's review again what we learned today and what we already done today. So we learned about what is periodontium, we learned what is periodontal disease progression, and we learned about why we don't want dental plaque and we need to do some plaque control. And we learned about we analyze about madam's periodontal charting and parental charting, and then we do some oral hygiene demonstration to control the plaque that resides in our mouth, and the last one we do some periodontal treatment. So that's it that we have in this for this session, dental hygiene education. So if madams happen to have any question, madam can just ask me right now or later. Okay. So for the dates that we are going to set the appointment is that we are going to do that later. So thank you for joining this session. And if you happen to have any question later, you can just contact me through my phone.